Hello and welcome everybody to today's edition of Coronavirus and Indian Global Mobility. I'm joined today by Pankaj Bhatia, my colleague at EVOs. Hi there, Pankaj. Can you hear me okay?
Hi, Brian. Yes, good afternoon. I can hear you perfectly. Thank you.
Perfect. And we've got some great guests on the show today as well. More of that in a moment. I'll introduce the guests in a moment. But let me tell you about what we're going to try and cover today. The first thing is that we're going to try and talk about the situation that's going on in India and around the world. In particular, we're going to focus on how it is impacting India, how it's impacting Indian outbound assignees, and also people who are on assignment, people who maybe who are trying to return from assignment, people who are stranded on assignment, and also on the inbounds that we're seeing and what's happening to them in India. And we've got some great guests on the show today. We're also going to talk, and I'm delighted that we've got Nandu again from EVOs with us. We're going to talk about a pro bono tool that EVOs has launched with support from a wide number of companies around the industry. And this is completely free of charge to help companies to manage, or to help assignees to manage in these particularly difficult times. So we're going to talk about that. We call that our pro bono COVID support tool. So we're going to be covering that later on in the conversation, although we are going to talk with our guests first of all and to get views from them as to everything that's going on. We want to make today as interactive as possible, and we've got a couple of ways of doing that. The first is that we are live on LinkedIn, so please do join the conversation. If you're out there in LinkedIn world, you're listening to this conversation, then please tell us who you are, where you are, make comments. We will hear your comments. The way it works is we will see your comments about 2 minutes later. There's a slight time lag using LinkedIn, but make a comment. We will come back to you, ask the audience questions, explain what your experience is. But also, if you actually want to join us on the show, we've got this wonderful facility where you can actually join us live on air. So if you want to, then I know it's a bit of a, this link is a bit of a thing to look at, but we are posting this link live on LinkedIn. But also just take a photo of this with your phone if you want. And then if you haven't got it from the LinkedIn comments, you can just type it out and join us live on LinkedIn. So hopefully we're going to have a lot of fun today. And we're really going to get into some of these comments and have a good old discussion. So that's one of the things that we're looking to do today. But let me just tell you a little bit about our guests. We've got some wonderful guests coming on the show today. And let me start off by introducing them. First of all, let me introduce Praveen. Praveen Hebale is from CGI. Maybe Praveen, you could just say a little bit about yourself by way of introduction.
Hello, everybody. Trust you all are safe and staying home. And these are unprecedented times, and I'm sure we've all found the mechanisms to cope with this. It's great to be on this live chat, live broadcast. I'm Praveen, and I take care of the global mobility operations for CGI, and I've been with them close to about 4 years now, and been around in the industry for a while now. And look forward to engaging in an interactive session today.
Cool. And also our next guest, I'm delighted to say, is we've got Nandu. And Nandu's from Atkins. Nandu, maybe you could just say a few words about yourself by way of introduction. Great to have you on the show.
Yeah, thanks, Brian. Hi, everybody. From last time, you can see my hair has grown because of like a few weeks after the corona. This is Nandu Nandakumar Kripanandam, heading the mobility for the Atkins SNC Lavalin. So I have 20 years of experience, and with SNC, I'm with close to 3 years. Again, thanks, Brian and Nitsan and Pankaj. This is a wonderful event, and it's very important for us to get to know what's happening and how we can share information. Thank you, Brian. Over to you.
Okay, thank you. And then our last guest today is our very own CEO, Nitsan Udan. So Nitsan, I know you're going to be talking about the pro bono COVID-19 support tool that we've launched later, but perhaps just introduce yourself.
Hi everyone. My name is Nitzan Yudan. I'm the CEO of Benivo, based in London, in the UK.
Okay, thank you. And we're getting loads of comments coming in on LinkedIn. So thank you to everybody on LinkedIn who's coming in. We've had Priyamada, good afternoon, Pankaj and Brian, Samir from Bangalore, Lisa van der Vaart, I'm not sure where Lisa's from, Dan O'Sullivan, Gaurav Singh, Priyajan Sinha. We got loads of people coming in. As we go through, please ask your questions of the panel, everybody out there in LinkedIn world. Let us know, what's on your mind, your thoughts, your experiences. We're clearly in a situation where nobody knows all the answers. In fact, I'm not sure we even know all the questions. So please do feed in your thoughts. So anyway, so let's move on. Obviously, I'm not in India, I'm fairly sort of distant from everything that's going on. But what I'd love to know is, what is the current situation? So maybe, I don't know, Pankaj, you want to kick off, and the others, come to the discussion. But what is it like at the moment in India?
Sure. So good morning, good afternoon to everyone. So pleasure being part of this panel, and like Nandu mentioned, I think it's very important for us to connect up and understand what's happening. So very quickly, maybe I'll give like a quick 3-4 minute update in terms of the current situation. So we had the India Prime Minister who came on to the television yesterday, and the lockdown has been extended. The India lockdown has been extended for the moment till 3rd of May. So the expectation is that maybe effective 4th of May is when maybe the things will kind of open up. But having said that, there have been some developments which happened earlier in the day today. So the authorities, which is the Ministry of Home Affairs in India, they've actually just maybe a couple of hours back have come out with certain guidelines providing some clarity around what the expectation is during this period of time, till the 3rd of May. So one of the things which is there as part of the lockdown is around the domestic and international air travel. As far as, of course, folks on the call are concerned, I think that's something which is important, that all domestic and international air travel for the passengers is something which is impacted by the lockdown, which means it's all prohibited till the 3rd of May. So that's the air travel, even movement within India by trains and buses and public transportation. So all of that is something which is prohibited for the moment. The health services are something which are still operational. So the hospital, dispensaries, the chemist shops, etc., are open. The financial sector, specifically the banks, are operating, but again with some restrictions, etc. What is also being proposed is around some of the operations for commercial and private establishments. So that's something which has been permitted or will be permitted to a limited extent. So what is proposed is that effective 20th of April, there will be some partial opening of some of the sectors, and specifically strategic sectors or certain other essential sectors are something which will be allowed to be operational. And so as far as the commercial and private establishments are concerned, specifically for this group of folks, the audience, the IT, which is information technology and the information technology enabled services, or ITES is what we call it. So that's something which is going to be allowed. But again, the authorities have mentioned that that's something which will be allowed to operate under with certain restrictions. So what they've mentioned as part of the guidelines which were issued just a couple of hours back is that the organizations can operate with approximately 50% of the strength. Similarly, certain data and call centers are something which have been allowed to be operational, but again, those are data and call centers which are essential and mainly run by the government services. Certain e-commerce companies, the likes of Amazon and other e-commerce businesses. So that's something which have been allowed to be operational during this period of time with certain permissions, etc. One other area which has been specifically called out is organizations which are operating in what we call as special economic zones or export-oriented units. And some of the IT examples which I was mentioning actually operate in some of these, special economic zones and EOU units. So that's something which has been allowed to be, operational. Again, there'll be conditions attached around that. They've mentioned specifically that for such organizations, they may want to house their employees very close within these parks or, very close to them. If not, I think the organizations are supposed to take care of the transportation of these employees and, of course, required to take care of, certain other basics, what they call as standard operating protocol, which they've also mentioned as part of the guidelines. Certain other guidelines have been issued for workspaces within the offices as to how you sanitize those, not having more than 4 or 5 people together at one point of time. If there are organizations working in shifts, having like a 1 hour time difference between different shifts, etc. So like I said, again, these guidelines have just been issued. I'm sure there'll be a lot more questions which will be coming in, but I think it's kind of a little encouraging to see, at least to some extent, some leeway has been provided for some operations to open up or to continue. Just a couple of final comments from my side before we kind of get back, Brian, to you, is on the immigration front. I think, again, we've seen a couple of developments in the last couple of days. Specifically from US, we've seen the US Immigration Authority, the USCIS, and the DHS, Department for Homeland Security, providing some relief to folks who are in the US on H-1B visa, and a lot of folks who are on this call, are from organizations which deploy people into H-1Bs. So there has been some extensions, etc., which the authorities have mentioned would be allowed. Also on the India side as well, which is the India inbounds, the foreign folks who are in India, the Indian Foreign Regional Registration Office, the FRR office, have also, given some leeway in terms of the extension for visas which are expiring or would be expiring. So I think we are seeing at least maybe some light at the end of the tunnel. Hopefully, I think these are sustainable things which happen in terms of how the things are developing. But like you mentioned, Brian, very unpredictable times, and we're just kind of keeping our fingers crossed to, hope things, improve and we are back to business, in due course. So back to you, Brian.
Okay, thank you much. Thank you very much, Pankaj, for that. For those comments. I mean, we've had lots of comments coming through on LinkedIn. Prateek has said, great to hear your insights, Pankaj. Girish from BGRS has come through. Kartik from Helmer said hi. Purvi Chatana has asked, how can you actually get to be on the show live? And Purvi, just to say that obviously you can comment live on LinkedIn, but if you actually want to be on the show itself, live on the stream, then just join us by following that link, and then that will take you backstage, and we'll bring you on. No promises, but as and when the conversations allows, we will bring you on. We have posted that comment actually in the comments box on LinkedIn. So if you're anybody else wants to come online, that's the link to follow. Or if you can't find the comments box, I suggest you very quickly take a photo of that with your phone, and then you can type it out the long, hard way. So anyway, so I'll leave that there for you for a few moments. But let me bring in our other guests now to talk about the situation. I don't know whether Nandu or Praveen, there's anything you want to add in terms of what you're seeing in terms of the situation at the moment.
Sure, I'll go, Brian. Thanks. I think the first thing about this situation is clearly it's unprecedented. I think most of us in our working lives probably haven't seen this, let alone the youngsters who've just joined in. And so that is calling for constant innovation, adaptation as we go on to ensure that we are able to just kind of stay ahead of the curve. Where the whole topic is about flattening the curve, we're kind of trying to stay ahead of the curve. And that in itself has been quite a challenge to see, to kind of anticipate what comes and react immediately to various regulations that are being thrown, various changes, restrictions that are coming in. And that has been quite a striking feature, apart from a lot of things we've done. And Pankaj mentioned a whole host of things that have been there. Without getting to the specifics of what we're doing, I think at a headline level, the sheer speed of reaction, the the uncertainty around and the whole nature of the beast, which was never seen before, is itself an absolutely new challenge and a new thing for us to deal with.
Okay, thank you, Praveen. And Nandu, what are you seeing at the moment in terms of the current situation?
So just to follow up on Praveen and Pankaj, though our Ministry of Home Affairs have given specifications, but still it's not very clear, because though they say that 50% IT and ITES, but they said that they have to get the state permission. So still there are a lot of administrative issues are there to see how we have to back in operations. Secondly, I think every organization is mulling towards that. How do they make sure that even if they have to get some of the percentage of employees back in office, they have to really clearly plan now that how they are going to manage, what are the things they need to do, etc. I think that's where the organizations start working towards it. Those things are very key at this point of time. Over to you, Brian.
Okay, thank you very much, Nandu. What I want to sort of move on, we've talked a little bit about the current situation, but my guess is that there's probably a difference between what was the initial focus, when this first crisis first started, 6 weeks ago, or however long ago it really started, and where we've moved to now. Now I think people have sort of adjusted a bit to it. We're getting used to the new normal. So maybe, I don't know who wants to start, but if one of you could start on, maybe you, Pankaj, on what you see as the difference between what the initial situation was and how it's evolved now to what's going on at the moment.
Right. So maybe I'll just kind of make a couple of comments over there, Brian. So I think initially, to start with, I feel, some of the cases, what the organizations were facing was just to even try and get a hold of the situation and understand the impact of the same, having maybe even some basic things as the list of people who are there in certain countries. Because again, if you recall, the situation started in China and then kind of slowly spread to other countries, right? So I think everyone was kind of caught a little unprepared, not being aware of where their population is, which countries are they, and I'm talking more from the perspective of the basic assignees who are managed by the mobility teams, and then kind of getting to the next level of even, getting an understanding of their other business travelers, etc., who are also kind of caught with this situation. I think that was a challenge which was being faced initially quite a lot by many of those organizations. Whether also ensuring, the necessary insurances are there in place, or, the family members who are the people who are accompanying the individual assignees, the accommodation situations, etc. So I think a lot of those initial issues were around some of those kind of things. And now, as we've kind of evolved, some of those things have shifted, or the priorities have shifted around ensuring that the employees are getting the right amount of support, specifically with a lot of lockdown which is happening, how you're able to furnish or get them the right information around the local support, around information around the hospitals, also ensuring how they're getting the right and correct and up-to-date information coming out from those different authorities, etc., right? Because there's too much of information which is going in, a lot of misinformation which is there as well. So I think it kind of moved from that initial stage of, trying to understand where the assignees were, versus now kind of, getting to a different level of support which is there.
Okay, I get that. And have you guys, Nandu or Praveen, seen anything, in terms of the evolving situation? Well, actually, I do also have one specific question that I've had raised on LinkedIn that I want to ask you. But let's just generally talk about the issues that you've seen, how it's evolved.
Sure, and pretty much like Pankaj mentioned, we started with the initial bit of ensuring that all our members have their insurance coverage spot on. And we realize in several situations, people have kids, additions to the family, and they forget to update their employer sometime. And the first check was to ensure that everybody is insured. Then we focused on a couple of other things. One was to check anybody who's staying on, and we took a view that this could last till end of April. At that point in time, it was second week of March or something. We thought the situation could be there till the end of April, mid-May. So we looked out and ensured that anybody who was on assignment was on site. We made sure that their work permits were valid, the residence permits were valid, so that they had no issues with from a legal right to stay in that country, whichever country they were in. And then we went out to see people who wanted to repatriate because there were restrictions getting put in place, etc. We did this massive exercise of repatriating people home because we realized certain countries were putting restrictions on people traveling back, and notably India. So we did this massive exercise of pulling people back wherever there was a need. And then I think the other thing we did was we started setting up a microsite for our assignees and putting whatever information we had, helpline numbers, emergency contact for insurers, and that piece became a very important one because that was the go-to point for any information our assignees needed about healthcare, people to reach out to, what to do in an emergency, latest in the travel restrictions, etc. So those are the things we did initially. I think from then on, we had to evolve to slightly more different things. Then we started looking out for things like people are working from home, and what does that take from a compliance perspective? Most countries have work permits which are location and client specific. So if you're working from home, what do you need to cover that aspect? And do you need, for example, in the US, do you need to do a new LCA posting, or are you allowed not to do that? In what circumstances do you need to file an amendment, so on and so forth? And we ran this check across countries to see how do you ensure people are able to work in a right legal way when you're not in your work premises. Thankfully, many countries have been very supportive, making exemptions, providing some grace period, things like that. So that was very useful. But that check was important to ensure our folks are in legal status, even though they're not working from office, etc. Now we see the things moving on to slightly different scenarios where we're seeing the initial economic impacts of those of the whole COVID-19 situation coming up, where people are getting rolled off on projects, and then questions of, I've been rolled off on a project, should I still pay that member a full salary, or can I be benched and not be paid, and questions like that. Many of those answers are there, but those questions are beginning to come up, and we are trying to react to those things. And obviously, we are taking a view of compliance on a rolling 15-day basis, how the lockdown extends, to keep pushing the validator, looking for extensions for the next set of people, etc. So it's become more a rolling thing, and we're getting to a lot of more specific individual cases as we go down the line. Thank you.
Thank you very much. Nandu, I think you're going to come in. Yep.
Yeah, absolutely. So I'd like to add, Praveen covered most of the bits, but I would like to add like few things. So initially, we were in a very reactive mode of bringing people who would like to volunteer to come back, and so we assisted on those. Now it's more stable. Few things what we have done is that, number one, we have ensured that all our assignees are registered with their embassies and their high commissions, etc., so that their embassies knows exactly that these are the people are staying in their countries. So if any assistance, then any emergency evacuation, then definitely we can seek the help of embassy. So that one we have done. Secondly, as they started staying, because some of them are with their with the small children and or with their partners, etc. So we started providing more like employee well-being, etc. So it's important to provide some of the assistance, because some of them couldn't access to the groceries, or they couldn't get the cleaning stuff, etc. So we have make sure that like specific to those individuals, whatever the requirements are, we done that. The third is about the medical emergency. So in that aspect, again, we have initially offered, I would say, the telemedicine for some of the assignees. Some of them we have helped them to access to the hospitals, etc. So we heavily coordinate, and we on a regular touch points with the assignees. Not specific to us. In general, we have seen that some of the organization are where they are reducing the salaries, etc. So I think it's very important that before you make any decisions, so it's important that you have to check whether we are comply with the minimum wages, or whether we are comply with any regulatory requirements or not. So before doing anything specific to the assignment salary or benefits, make sure that you validate those, because most of the countries doesn't allow to reduce salaries for the assignees. Some with the minimum wage, some you have to notify, some you have to get approval before you make decisions. So I think these are the learnings I would say that I have come across now. So so over to you, Brian. Thank you.
Okay, thank you so much. Just looking at LinkedIn, we've had a couple of specific questions I'd like to ask to Pankaj, Praveen, and Nandu. Very specific. The first question is this. They're on two separate subjects, but I'll give you both questions at the same time. In fact, I've got three questions coming through, but I'll file them all out and then we can pick them up as we go through. The first question is, have your expat employees been availing the benefits of special flights out of India? What has been the success rate for getting on these flights? Okay, so in other words, have you managed to get any assignees out of the country on special flights to avoid the lockdown? The second question is, have any of your companies reduced work hours for H-1B workers in the US? And if so, how did they implement this? And then the third question that we've got coming through is, for business travelers struck abroad, are you continuing to pay per diems? Okay, so three completely different subjects. Taking them in the first order was special flights out of India. Secondly was reduced work hours for H-1B workers. And the third question was per diems. I don't know whether any of you can answer your experience of any of those three.
Sure, I can go with first question. Special flight. So we have registered all our assignees with the both the US and the UK High Commission, but so far, like the special flights are arranged by the UK consulate for coming days starting from 18th. So far we have registered, but we have not got any confirmation, or we are not successful. So I would recommend that please register, and they will put you on waiting list. I'm sure specific to like Chennai and Bangalore, as of now, it's one chartered flight on 20th of April, but you will get more flights. But I would recommend you please register, ensure that your assignees are registered, and if they ask to pay, you have to pay immediately to secure the seat. So that's on that one. If Pankaj or Praveen would like to add on that.
I think just one comment from my side is, and I don't know how accurate this was, but I did read a newspaper report maybe 4 or 5 days back where I think they did talk about some chartered flights specifically into the US for US citizens. And I read that some US citizens actually took a decision that they felt safer being here than kind of going back.
Just quickly adding that we got a request from Air Canada, and if there are any very urgent cases where you need to put them on this plane, we could do that. But essentially, the message was that there was a specific flight arranged for the consular staff and some high priority cases. We chose not to use that because we did not have anything like that. But those options are very limited, and they're very focused primarily for the consular staff, etc. And then, yeah, like Nandu mentioned, if you've registered with your respective high commissions or consulate, that makes things easier. At least the choice is visible to you.
And if there are any special conditions, sorry, Pankaj. So if there are any special conditions like illness or something, or specific to do with their family or young children, etc., then definitely they can put those specific requests and make themselves to prioritize their requests. So that's also possible. There is an option to that.
And I know that we have a reverse situation as well, where folks who are Indian citizens stuck in other countries also want to come back. So I think there's something similar where I think they have to typically register themselves with the local embassies, consulates, etc. And basically, if there are flights available, then that's when they'll be able to avail themselves for the same. But I know not much is kind of happening on that front at the moment because of all the restrictions.
I'll hazard a shot at the second question, but the caveat is I'm not a lawyer, and please check with your advisors before you take any decisions around that. On an H1, the wages are very closely monitored, closely controlled, etc. And if you're looking to reduce wages on an H1, there are two thresholds I want you to consider for sure. The first one is that despite whatever reductions you make sure you don't fall below the prevailing wages mentioned there. There could be an opportunity to see if the prevailing wages are mentioned for X number of hours, say 40 hours a week, and you want to reduce it to reduce the work time to 32 hours, there could be somewhere to make a proportionate reduction, but be very careful. Minimum wages or prevailing wages is a holy grail in the US for H1s. So be very careful, seek specific advice before you venture anywhere there. Second, any such reductions you make should be similar or on par with what is made for local US employees or US citizens working for your company. It cannot be dramatically different. It cannot be targeted only at H1B assignees. So parity is extremely important. So that shows that whatever you're doing is consistent with all people on your US payroll, whether local employees or assignees on H1. But there are some possibilities to do that. but I also have to worry that it's fairly constrained. Please get specific advice before you venture anywhere there.
Just to add to that, Praveen, I think one assessment everyone has to do is that whether it's really cost beneficial if you have to pay the amendment fees and then if you have to pay the attorney fees vis-a-vis the trade-off of the salary, is that really worth? So probably you have to do the cost impact analysis as well, in addition to what Praveen mentioned.
Yeah, I think the last one is a fairly easy one. Please pay per diem. There are people who need that money more than ever. And I think this is not about duty of care. It is a fundamental humanitarian gesture first, and then the fundamental responsibility of the organization. In trying times like this, I think the need for support is even higher. And the least we could do is make sure they have the money available to them. You can always figure out whether it's appropriate, not appropriate later. But business travelers, please make sure they have adequate to survive there. And even if you have cases where people have come back on a vacation and now are unable to travel to the US or UK because of the travel restrictions, please make accommodations. Please check if you can make accommodations to support their. If somebody's paying a monthly rent, should you make that exception to continue to pay that monthly rent while you may have rolled him off an assignment because this person is not able to travel out? I mean, at a headline level, I'd say please make sure that money is available because it's the least we can do at this time. We can't fly them out. There are restrictions. We can't do much. Otherwise, we can't guarantee a protection against any risk of infection, etc. But please make sure adequate money is available right now.
Thank you. That's a great segue, actually, as we move into the second part of our conversation today. Because Praveen, I think you were making the really valid and strong point that this isn't just about money. This is a humanitarian issue for our people as well. Which brings me on to the subject that we at Benevo have launched a pro bono tool, and this is our humanitarian gesture. And I know a number of service providers around the world have joined in, and obviously a number of corporates are taking advantage of this. There was a very interesting survey that I read out this morning, which showed that 75% of all assignees who took part in the survey had never accessed and didn't know how to access their host country healthcare system before this crisis started. And of course, all those people, let's think about those assignees. They're far from home by definition. They probably have got few friends and family. They certainly haven't got the support situation. Local government information is going to be in the local language, which may be hard for them to understand. And they may not know their way around the local system, like the local healthcare system, local care systems, in ways that local do. So assignees are in a particular difficult situation. And for that reason, we came up with the initiative of launching a pro bono COVID-19 support tool. And as I mentioned at the outset, this tool is completely free to anybody, whether a Benevo client or not a Benevo client. We're offering this completely free. This is our humanitarian gesture that we're making. And so I'm very honored that I've got Nandu Udan, who's our CEO at Benevo, here today. And he's going to tell us a little bit about the tool. And more than that, he's actually going to show us a quick demo. And we do encourage everybody on the call to, first of all, spread the news far and wide, tell other people that the tool is out there. If you're a corporate, please do use it. It is completely free of charge, and we will personalize it for you as you want. And if you're a supplier and you want to add information into the tool to help, then please do. We want to create a platform where everybody can help. What in the end of the day is our common clients, the individuals who are actually on assignment, stuck in a foreign country, and trying to work their best through this crisis. So Nitsan, do you want to tell us a little bit about it and then maybe show us a demo as well?
Yes, thank you, Brian. So it all started a few weeks ago when some of our clients asked us about how can we better communicate with people who are now stuck in a country that, as you mentioned, they don't know the system, they might not know the local healthcare, not even how to, which supermarkets are doing deliveries and what are the tips and tricks of getting a slot. And we started to build that, and then we realized that this can actually be relevant to a lot more people, and it's actually an opportunity to provide support for people at the time when they need it most. And what we have launched is this COVID-19 support tool that is a free service, right? We're not charging anything, not now and not in the future, and it's customized for every corporate who wants to do it, whether it's a client or not a client. And what we are committing to is to go live in 3 working days. And today we want to talk about, as you mentioned, two stakeholders that we want to engage with: the corporate and the suppliers or vendors or partners of the industry. So for the corporates, what we want to ask is to share with us, either here on by joining the live stream or on comments on LinkedIn, what challenges are you currently facing? Is there anything that we can add value, and we will commit to getting this specific challenge solved within 3 working days. And when I'll do the demo, I'll also highlight some of the specific challenges that we've been solving for different companies. And for suppliers, what we want to invite is we want to invite everyone who wants to provide content, service, advice, anything that is at no charge, but can help the community to add it to the tool and add it to the platform, because in the end of the day, we all share the same mission. We all in this in order to improve employee experience, to make employees feel welcome, to support them in moments that matter. And that's an opportunity for us to come together. So we invite you to either share it on the LinkedIn thread or contact Brian or me directly after. And we've announced that last week, and we got overwhelming response with so many friends in the industry coming together and adding content, which I'll show some of it today. Some of it is still in the process of being uploaded and added, but just to name a few, from immigration advice from Fragoman to advice about handling your pets from Pet Travel Award to REA and Impact Group with coaching and advice to handle stress, and living abroad on local specific content, to others that we will of course mention later. So let's have a quick look at the tool. What I want to clarify is that this is not our core product, right? This is not what we do Benivo as a company. We're not going to talk today about our destination product, about pay later, about all the other things that we do. There's going to be plenty of time to talk about it when things come settle down and travel bans are removed. Today we're talking about a specific free tool that we've launched to support the COVID-19 situation. So I'll share my screen now. Great. And the tool. Sorry, Brian. Can you see the screen? No, not yet. Okay, I think now you should see it.
Not as yet.
You know?
Nope.
Okay. How about now?
Not for me. I'm not sure. Brian, Praveen, Nandu, are you?
No.
Now we can.
Yes?
Yes.
Yep.
Great. Okay. Sorry, everyone, for this short delay.
Technical hit. That's the problem with broadcasting from home. Apologies. Over to you, Nick.
Good. Thank you, Brian. Okay. So the platform, the tool is a branded tool. So I'm going to show some of the brands who are currently in the front line of fighting the COVID-19 situation, just as an example of the different look and feel of it. And we're going to jump into a tool that is called Start Industries. In the comments, if anyone recognizes the source of this name, will be good to hear why do we call our demo platform Start Industries. And there's a follow-up trivia question on it if you know the answer for this one. And this is a tool for the assignees, or the employees, everyone who is currently in a different location than where they normally or where they used to live. And the platform is going through a process of onboarding, so getting personalized and specific to show content that is either related to their demographic, their location, the company they work with. I can choose that I'm going to live with my partner and children, so I'll get some advice about that. Otherwise, I will see a different type of content. One of our core principles in Benivo is to share the learnings from colleagues. Right? We believe that everywhere in our life today, we make decisions based on other people's experience. So just like when we shop on Amazon, we look at star ratings and reviews before we make a decision, or when we book a hotel on Expedia or Booking.com, we look at the hotel star rating rather than the hotel's the number of stars they have. So the same concept we brought into relocation, allowing employees to see where their colleagues live, how much they pay, which bank account they chose, etc. We took the same concepts and we brought them into this situation. And I'll show you a few examples of that. The platform is supporting 103 languages. If anyone wants to challenge us to a language on the comments, would love to hear that. Please try to be as specific as possible, and we will switch to that language, and we would love to get your feedback on it, on the quality of that. So looking forward to get challenges on the comments. All right, and let's have a look at the platform. There are a number of areas that I will cover. The main one is going to be on the actions, which is showing everything that is happening and access to the core information. So for example, get local health and transport updates. I can get into this and find the nearest medical facility in case of I'm not feeling well, or I want to know where is the center. I can just click and get to that. If I want to know what's happening with transportation, what is available, is there public transportation or not, this information is constantly changes and it's hyper local. So I can just go here, click on it and get to the relevant place and find out that. And that's available globally, anywhere in the world. Just tell us which countries. And as we said, we commit to go live in 3 working days. Some other things I've mentioned, the immigration updates that are powered by Fragoman. So they can go here and find out the latest information from Fragoman that is being updated a few times a day and educate themselves on the situation. And everything here on this platform and any Benivo tool is customizable. So if for your company you want to remove content, you want to add content, we can do that as well. We have a tool for self-assessing whether you should go and see a doctor or not, if you have any symptoms that Global Excel provided us with. And here we have information for government official advice, etc. Good. Some of the companies ask us to help them collect feedback about what the assignees actually want, and we were able to add that very quickly. Simply ask them, what can we as your employer can do to further support you? And that information goes straightly to the mobility team or to any other email address that you will define. So allowing us to get very fast responses and engagement. Other examples of things that companies ask us to help solve is to a little bit create the feeling of a community, right? So for those people who are currently based in a different location, how can they better connect to each other? One thing we've done is we've opened a WhatsApp groups where either the employees can communicate with others or their spouses. Right, so the spouse or the partner can connect to other partner who is also at the same place in a different in that country. Other things we have here is just sharing of the home offices that some people have set up. So that's another company asked us to do it with employees just sharing tips about what works for them or not. That's actually mine. So just for the demo, we are showing here the Benevo team examples. But creating that a little bit feeling of atmosphere that is positive. On the destination information, they can get information about food delivery options, remote learning, getting their groceries, which options are available, and I can even see which ones are popular with my colleagues. And the final bit is on the gamification of mobility. Employees can actually go on the platform and answer questions to help others. So I can answer questions on the COVID-19. So for example, what helps me most when I'm feeling stressed? Me personally, it's exercising. I can answer that, and I can see here the responses of my colleagues. And how do I make the most productive use of my time? For me, is sticking to a schedule, and I can see again how that interact, and that's also how we collect so many insights to share with their colleagues. And the gamification here is that by answering these questions, I am gaining points, and these points can be redeemed into a donation to a charity of my choice. So I can choose a charity that I would like to support, whether it's now the most popular ones are obviously in the healthcare space. Before that, it was fighting inequality in education, still very important, and Benevo will then donate on their behalf to that charity. So that's on high level, a quick introduction to the tool. Brian, anything you would like to add?
Yeah, I mean, what I found, I mean, I've looked at this tool for a while, and I think it's something that's really quite noble to. I mean, maybe that's too strong a word, but you know, this is a way that we can all come together. You know, I'll put it on screen here. You know, let's all work together. I mean, this is an area where all of us in mobility, maybe for the first time in our careers, can put aside, you know, who we work for and just say, you know what, there's actually a greater good here. We can all do something to help people who are in, you know, in many cases in desperate need. They are stranded in countries where they don't really know exactly how it works like a local does, and they may not even speak the language that well. So if you're a service provider out there, please do contact me or contact Pankaj or Nitsan via LinkedIn or email, and let us know how, you know, we can integrate your content and your expertise into this tool. But also, if you're a service provider, do please spread the word. I mean, you know, to help, you know, to let companies know. And if you're a company, we can do this within 3 days. We can get this live within 3 days. We're not going to charge you a penny for doing it, whether you're a client of ours or not a client. This is purely a humanitarian gesture. So it's there. Let's use it and let's help. And I go back to that point I said at the beginning in terms of that survey, that I saw just this morning. 75% of assignees have never accessed their local healthcare system before and had no idea how to go about doing it. So, they're all in the dark in ways that local aren't. And they may have different needs. I mean, yes, there might be information locally about how to get, for example, free online online deliveries of food and other things. But expats may want different food. They may want different, they have different needs, and so what they want may not be the same as the information that's coming out generally from their local HR department. So with this tool, our assignees can help each other. They can learn from each other. They can share information, and they can generally help each other to get through this, this dreadful crisis. So I don't know whether one of the others, Pankaj or Praveen or Nandu, want to say a little bit about the tool or a little bit about what they're seeing in terms of helping assignees to help themselves.
Certainly, I think. Sorry.
Yeah.
So what I was mentioning, Brian, is I think the access to the up-to-date information, the access to information for the specific destination the employees are. I think one of the things that we are seeing is specifically on the need for temporary accommodation and what options are available. I think those are real needs, ongoing needs which the employees have, and to get that assistance, and that up-to-date information is, I think, very, very critical.
Yeah, thanks for mentioning that, Pankaj, because we had one corporate who asked us to help their assignees find solutions to extend their temporary housing, because the challenge they have is that there's no one who's doing it for the employees. The assignees need to do it themselves, but obviously now it became a little bit complicated. So what we were able to do is to build a quick tool that allows them to understand what options are available for them. Just to clarify, we don't have a vendor network, and that's not something that we promote, but we just connected them to a list of vendors in accommodation that were able to offer them solutions, and all of that they could do through the platform. So on one click, they got access to different service apartment providers as well as to an Airbnb, and they could make the choice where do they like to stay. They will go ahead and book it and invoice the company, and we've created all that process into the platform to support that, and all of that within the 3 working days. So really encouraging any corporate there to challenge us with anything that they are struggling with, and we are highly committed. I have a team of more than 50 people who are ready to jump on any challenge that will come.
Yeah, and just very quickly, Brian, one other thing I'd like to call out is on what the other employees within the organization are doing, sharing that up-to-date information from that employee experience of those same organizations, the social insights. I think that's something which always carries a great weightage, etc. So I think that's something which is very, very key that we are able to, deliver as part of this pro bono, platform as well.
Just to add to that, it's a great initiative. Thanks, Nitsan. I have a couple of questions. Number one is about the data privacy. So you showed that the assignee have to register in the pro bono tool. So how you ensure that the privacy of those information is secure? And my second question is on the sorry. Yeah, just I'll complete. The second question is on the vendor, the partner. You said that the service providers can use. So how do they take the help of this to communicate with their clients?
Yeah, thanks. So obviously data privacy is core. We are ISO 27001 certified, and more importantly, what we've done here is we've created the ability for each employee to decide if they would like to share their details with Benivo. So they only share their email address and full name, not more than that, but the decision is with the employee. So the corporate does not transfer to Benivo any information about employees. The only thing they will give is a link. Every employee goes to that link and make an individual decision according to the terms and conditions and decide whether they want to use the tool or not, and if they want to have to share their email, and it can be their work email, of course, and full name with Benivo. That's how we were able to allow to go so quickly in 3 days with this tool. With regards to the service providers, this really depends on each corporate and how they work. If you already have your preferred network of vendors, we will just adjust to that and make sure that the communication is only sent to them. If the example of the corporate I gave, they did not want to recommend anyone, so we just included a list of vendors that are available per each location, and the employee will go on the Benivo platform, enter the dates that they need to extend, the specific requirements they have, the budget, click a button, of course, agree to that, and their information. That information is sent to a number of vendors who will then contact directly the employees with options that are available for them to book during this time and according to their budget. So that's how it works for that.
Thank you.
And we've had a number of comments come in from people saying, great initiative. I know one from Rumka from Genpact said, great initiative by Benivo to build such a tool to help assignees. And then from Priyamvada M, I don't know what your last name is, unfortunately, from I think Helmer, she says, is there a possibility for HR or mobility managers to be part of a common platform to discuss their best practice or solutions that they're implementing for their assignees during this time? So I'll leave that question out there. That's probably slightly different to what we're doing. The platform that we've developed is corporate branded and corporate based, so it's aimed for each particular company. But I would just emphasize, if you like the tool, then please do get in touch. We'd love to have the opportunity to show you the tool and to develop it for you internally. And as I said, our challenge that we've set ourselves is that we will create you that tool within 3 days, 3 working days. And once again, just to emphasize, there's no trick. There's nothing sort of here. This is a completely free humanitarian offer that we're making. So if you think it might be of help to your organisation, please do take us up on the offer and let us help you to help the assignees. I'm afraid we are actually pretty much out of time now. So that all that really remains is for me to thank all our guests. So a big thank to Praveen Hebale from CGI, to Nandu from Atkins, to Pankaj from Benivo, and of course to Nitsan from Benivo. So thank you everybody, and most importantly, thank you to everybody out in LinkedIn world who have been sort of feeding in your comments and who've been listening in. We do have another session later on today, not aimed specifically at India, but it's a global update. That is at 3 p.m. UK time this afternoon, which I appreciate is quite late for those of you in India. But the recording will be on LinkedIn after the event. If you don't want to listen to it at home over your dinner, as I said, it will be on LinkedIn afterwards. And we will be coming back with another Indian update in a few weeks' time when things have hopefully turned a corner. So all that remains is say thank you to you, and of course everybody stay home and be safe. So thank you and goodbye from all our panelists.
Thanks, Brian. Thanks.
Thank you.
Thank you.
Thanks.
Cheers.
Bye.